If you're tired of being stuck in a posture that's like this, or if you're a physical therapist or a personal trainer helping patients or clients get out of a posture like that, then this video is for you. What's going on, guys? My name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. And in today's video, I am sharing how we can use one foam roller exercise to help that stubborn, arched back position that tends to create a lot of pain. We're first going to talk about why this happens and how we can start to use a foam roller to fix it. And then we're going to talk about the specific steps when executing this one foam roller exercise. So let's first understand this problematic posture. What typically happens is we have a pelvis that anteriorly tips forward, and this creates a rib cage that flares up due to the spine moving into extension. And usually what happens with this type of posture is that a lot of people complain that their hamstrings feel weak or tight. Well, this is a normal consequence or normal effect from the position of the pelvis. So if we have a pelvis that tips forwards, we are going to have a hamstring that goes along for the ride. Conversely, if we start to reposition the pelvis, we're going to tip that back and this hamstring is going to relax. Here's the cool thing. These muscles, it's not really a muscle, right? But the muscles respond from the position that the pelvis or the bones are in. And so when the pelvis is forward, we're going to have a hamstring that is really lengthened and weak. And conversely, when we have it that is more in a neutral position, we start to bring that back to its normal position. That normal position can then actually start to pick up leverage. Leverage to hold the pelvis in a better position. That's what this foam roller exercise is going to do. We are first going to bring the pelvis in a better position, and then we're going to ask the hamstrings to work. What are we working on? Sure, strength of the hamstring, but also strengthening them so that they better understand how to hold the pelvis here. That's how we can start to use exercise to improve posture. Getting muscles stronger in a new position that they retrain how to hold the skeleton a certain way. So with that said, let's jump through this one foam roller exercise so we can start improving posture. So the foam roller exercise that I'm referencing is an isometric foam roller hamstring curl. It's really simple, but I always tell patients and clients that it's life-changing. It's life-changing because you should feel your hamstrings like you've never felt before. So let's go through how we want to coach this and why this is so effective. So the first thing you're going to do is go ahead, drop down, place your heels on the foam roller. It's really important that it is our heels. A lot of people start with their toes, and you'll see as we start to work through this, it's going to jam you up. So heels start on the foam roller. Step number 2, we're going to get out of this anterior pelvic tilt and bring more of a posterior pelvic tilt where the rib cage starts to naturally come down. Step number 3, peel your back off the ground. A lot of times people will just lift their hips, and when they do it, they'll go back into their extended posture. Think of peeling the low back off the ground. This helps you stay a little bit more rounded. You should see this more rounded shape compared to this straight shape. So we stay rounded. From here, we pull the heels back until we're at the midfoot. What you're going to notice is as you pull that heel to the midfoot, you are going to try to arch or lift. Try to maintain that slight tuck. Even when I just did it, I felt that natural bias and inclination to try to arch. Hold on to this swooped position, and you should feel your hamstrings. From here, think about 2 gas pedals. If you were to push both heels down like you're pushing on a gas, that's what we're looking for. And then all we're going to do is raise the arms so we get the rib cage to come down. And then all we're doing is breathing. Inhale through your nose, exhale through your mouth. You want to be in this rounded position, not feeling like we're arched. And what we're doing here is we are bringing the center of mass back away from the normal posture that's problematic. And we have the hamstrings in a shortened position where they have leverage to control the pelvis. So we're starting to A, strengthen the muscle, but B, retrain the brain that when we're in this more posterior direction, we have the hamstrings for our stability so that we can maintain a little bit more concentric bias on them to actually start to improve posture. Give this a shot. Let me know if you have any questions in the comments below, and I'm eager to hear and see how you like this exercise.